Hello and welcome to Health Matters on Channels Television. Thanks for joining us today. I am Mary Alale Yusuf. The concern of every AIDS carer is that everyone, everywhere, regardless of social standing, financial status, or other categorization, has equal access to HIV prevention, testing, and treatment. In 1981, the first cases of the illness, now known as acquired immune deficiency syndrome, AIDS, were reported from Los Angeles in 5 young homosexual men diagnosed with pneumocystis carinii, pneumonia, and other opportunistic infections. In Nigeria, the first case was reported in 1986. Several decades on, what has been achieved by way of prevention, treatment, management, and elimination. So far, about 40.4 million people have died from AIDS. There is transmission in all countries globally, some reporting more cases where previously it was on the decline. The World Health Organization estimates that about 86% of people know their status. Of those, 76% were receiving antiretroviral therapy, and of those, 71% had suppressed viral loads in 2022. We'll look at this today, as well as how accessible management is for people living with the condition. My guest is the Director General of the National Agency for the Control of AIDS, NACA, Dr. Gambo Aliyu. Dr. Aliyu joins us virtually from Abuja. You're welcome to the show.
Thank you, Mary, and apology, I couldn't make it on time. I'm on my way to your studio, but yes, I'm happy to join you virtually.
So glad we can take you from wherever you are, sir. So why are some countries reporting more cases of HIV/AIDS? Countries that were on the decline before in numbers, they have increasing numbers now. Why is that? And is Nigeria one of those countries?
Thank you. The rate limiting step of HIV control and essentially AIDS-free society is identifying people who have the virus in them. If you identify virtually everyone in the community that has HIV or have HIV, then you are getting closer to getting rid of HIV within the community. Why? Because the more you identify the people that live with the virus and keep the virus in them, the more you keep the virus away from circulation. And if the virus is kept away from circulation, it means newer cases are not going to be seen. And when newer cases are not seen, it means transmission is being cut up. And that is the goal. Once you cut up transmission, you continue to keep HIV within the people that have it. These people will not allow the virus to come out of them, and at the same time, the virus will not have opportunity to kill them, and it will, of course, not also make them sick. They live with the virus until they die, or eventually we get a cure for HIV. So that is the goal. If you hear countries reaching 95, 95, 95, it means they have done a good job in identifying those people living with the virus, as well as
Okay, it looks like we're having a problem with network. We'll try to reconnect with Dr. Gambo Aliyu
the
there.
Within is the global goal. Getting to 95% of every person to be identified, place or lifestyle medical to end. Hello, can you hear me?
Yes, we can. Continue. We hear you, Doctor. Continue. Okay, it looks like we're having a bit of a problem again.
That is what the point I'm trying to make is that the more we get closer to identify among us. Hello?
Yes. Okay, so in 1999, the theme was End the Silence. But in recent years, it's been revolving around access, community, shared responsibility, ending inequalities, and now we're back to communities. That's letting communities lead. How do we let communities lead? And why are communities so important? It looks like we're having a problem getting across to the doctor.
Communities are important because this virus is circulating within the community. The service around here is faltering. But I'm getting closer to your station.
Okay, but keep talking. It would be nice if you just stay in one place, doctor. That will make it a lot better. Let's take you from where you are. If you're in one place, we will hear you a lot better. You were speaking about communities and why they are so important and how communities can lead.
Yes.
While we wait for the doctor to come on, we are dealing with issues of stigma, some things that make it difficult for HIV/AIDS to be limited stigma and the very fact that some people don't even understand the disease. Then, of course, there's some types of people who get the disease. Since it is usually sexually transmitted, that also is a problem. We have communities we call special needs people, people who use drugs, people who have same-sex relationships, which are kind of like anathema in our society. So these are some of the people who keep the news to themselves and do not come out to be tested. They also don't get discovered, and so eventually spread the disease. So these are some of the things we're trying to correct in society. Yes, some things may be frowned on, but we still need to treat the disease so that it doesn't spread to other people, especially unsuspecting people. Those are some of the issues that we are dealing with in today's world concerning the HIV/AIDS scourge. Then also there was a bit of a lull in treatment of not just HIV/AIDS, but other diseases like tuberculosis and HIV, also immunization during the COVID-19 pandemic. And many people fell back on their treatment. Many people lapsed, and many people missed their visits, missed their appointments, thereby making matters worse. That's probably the reason why some countries started reporting more cases rather than declining further. And one of the things we want to find out is if Nigeria is among those countries who started reporting higher cases rather than lower cases because of the pandemic. At this point in time, we're taking a short break. We'll be with you soon. Stay with us. Welcome back. It's Health Matters on Channels Television, and we're still talking about HIV/AIDS and how to eliminate the scourge. With us is Dr. Gambo Aliyu, DG NACA. He's now in our studios. And Doctor, you told us why HIV/AIDS cases increase. But what I didn't hear is whether the increase also has happened in Nigeria. And if so, why?
Come again, please.
Yes, we were saying that some countries actually recorded an increase in cases. Rather, countries that were on the decline before reported an increase in cases. I'm asking if Nigeria is one of those countries, and what could have caused such a thing in Nigeria?
we are looking at the data we have currently, and we are working on the data to be able to ascertain what our numbers are. But over the years, we've seen gradual decline in number of people that are getting the disease, as well as gradual decline in number of people that are dying from it. This is very important because these are the two major indicators to show that you're moving in a positive direction towards ending AIDS by the year 2030. The number that are getting the disease and the number that are dying from the disease, both of them must continue to decline for you to achieve the goal of keeping HIV within people that have it without allowing the virus to come out and affect other people in the community that do not have it.
Okay, so you were also saying that you're saying community should lead because people with HIV live in communities. Fantastic. That makes a lot of sense. But if stigma is still a problem, then communities could be a problem. Are we seeing less stigmatization in communities these days?
Yes, we are seeing less stigmatization, and that is why we are calling on the community to do more. Community can actually help us end AIDS before the year 2030. All that is required is to show sympathy and to show concern to the person living with HIV to make sure that they are not stigmatized and they are not discriminated against. We should also encourage members of the community to demand for HIV services. The gateway to getting the service is having you tested. You can also test yourself, actually. You can sit in the comfort of your room, have a self-test applied on you by yourself, and then at the end, if you find out that that shows you have HIV, then you come to our facility where we get to confirm it. And once that is confirmed, we can help keep this virus within you. The good thing is that we will not allow it to make you sick. And at the same time, we will not allow it to get out of you to affect your new ones, your loved ones. And also, it will not kill you. But many people do not know about this. Many people do not know that now HIV no longer kills, and HIV can be actually managed the same way we manage diabetics, the same way we manage hypertension and other chronic illness. This is the bust of where we want to see all of us globally arriving by the year 2030, which means anybody that has the virus can now comfortably live with the virus without the fear that the virus can kill him or her.
Okay, so there's a set of people, a group of people who, even though communities are becoming more accommodating, let us say, these people will still have a problem with society. The people who have same-sex relationships, people who use needles to take drugs and all that. I suppose that these self-tests kits are for such people. How do they get such kits so that they can bypass the community, as it were, because the community does not accept them and probably will treat them badly? How do they bypass them and get these self-test kits?
At the moment, they get this self-test kit where they get our services. We have points or sites in our services. We call them, in our communities, we call them one-stop shop. The one-stop shop are areas where we access or have access to the key affected population without them feeling the burden of stigmatization, without them feeling the burden of being molested or stigmatized or discriminated against. Thus, places are places where these services can be accessed at the moment. At the community level, we are working hard to see how we make those self-test kits available. People can walk to pharmacy shops, to places where those kits are available, get them, have the test run on them, and then later on sharing the result with us. And if the result is negative, they can actually come to us to learn how to remain negative for the rest of their life. But one thing we want to see changes in our community on the side of stigma and discrimination is for the community to remember, no matter how much money the government of Nigeria put to end AIDS, and no matter how much money the American government and the Global Fund contribute in our effort to see an end of AIDS in Nigeria and globally, we cannot achieve that without the cooperation and the assistance of the community. What we expect from community leaders to do is to take a resolution that no baby in our community should be born going forward with HIV. And how do you ensure that? You ensure that by making sure that every pregnant woman access our antenatal services all over the country that are available. And when they access those antenatal services, they access HIV test. And if they don't have access to our antenatal service, at least at the community level, they have access to HIV test. Every pregnancy should be tested for HIV to ensure that that pregnancy or the pregnant mother is not carrying the virus. If she carries the virus, we have 100% success rate of preventing mother-to-child transmission of HIV. There is just no way we can eliminate mother-to-child transmission of HIV without the full cooperation of community. So this is where we're making the emphasis. Community needs to lead, and community leadership needs to realize that the people that have HIV within you can only help you to keep HIV within them if you help to stop stigmatizing them and discriminating against them. As long as you continue to stigmatize and discriminate against them, they will continue to give people HIV around and within the community simply because they are very fearful of coming forward to access our services, especially the treatment services, which is very, very important in keeping the virus within the people that have it and making sure the virus does not have opportunity to spread across within the community. So it is a win-win.
Okay, let me quickly jump in there.
People living with HIV/AIDS to feel comfortable and to have access to our services, and then they keep HIV away from you.
Okay. We've spoken about mother-to-child transmission. That's a terrific way of catching the infection when it's really young. But is it not true that apart from mother-to-child transmission between partners, there is a cocktail of medication that reduces the viral load such that it cannot even be transmitted to a partner? Is that still true in Nigeria?
It is true. That is what we are saying. This treatment are available. The cocktail treatment you're talking about is available everywhere and in over 2,000 centers across the country. And it is free. All you need to do, first of all, know that you have HIV before you can access it. And when you come, we test to confirm that you have HIV. Once we realize you have HIV, we give you this medication. And the other medication that is given to those that are at higher risk of getting HIV is the one we call PrEP. They are a bit different from the cocktail that is given for people that have the disease. This is given to people that you're talking about, men who have sex with men, the injection drug users, the transgenders, and the female sex workers. Because of their behavior, because of their way of living, and because of the business they do, they are at higher risk of having HIV, and they are at higher risk of transmitting HIV to others. To stop them from having HIV, drugs are now used, and these are what is being called pre-exposure prophylaxis. They know where they access those services, and they know where these services are given. All we are calling the member of those communities to make sure they take advantage and those medications are utilized.
So talking about all these medications now that prevent transmission and the pre-exposure prophylaxis, if everybody who had HIV in Nigeria now were to know their status and you had the numbers, would we have enough of this medication to give them as and at when due?
Sure. We even have more than enough. For every year we make projection. We look at the numbers we have already, the ones that we are treating, and we look at the number that may be added, the new infection. And we make our budget to cover those that have the infection and are on treatment, and those that are going to be identified later within the year and are likely to be added to our treatment. So yes, we have this medication all over the country. They are waiting for people to go and take them.
Okay. Now, there's a lot of talk about antimicrobial resistance, these days with every sort of disease. Is that a problem with HIV/AIDS medication? How is it affecting the response and the management?
Yes, it is, and it's a major problem with HIV. That is why it is important for people, one, to know where these medications are taken, two, to know how these medications are taken, and to listen to the healthcare providers in terms of the instructions that are given. It is important for people to know that adherence is a major component of getting this virus to be suppressed and to disappear from the blood of people that have it. Why? Because without adherence, then there is every likelihood this virus is going to come back strong after exposing it to medications, and with time, it will refuse or resist to sense that medicine, and resistance will come in. And once resistance comes in, that set of medication may not longer be useful for that particular patient. That is why we have several lines of treatment. We call the first line, the second line, and the third line. The first line is the drug that is taken by more than 90% of people that have HIV within a particular country that are responding to. The second line are the few thousands that have resisted the first line, and now they need a higher drug or second line drug that are a little bit more expensive than the first line drug. While the third line are a few hundreds that have resisted the first line, they have resisted the second line, and they are now being introduced to the third line and the final line that the virus must respond to. Okay.
Enrollment for clinical trials, for a new HIV vaccine began earlier in the year, in the United States, in South Africa. Can you tell us a bit about this and how that is going? What stage is the trial at?
Right. Clinical trials for HIV vaccine, I think, started more than 20 years ago. And they have been on, and there has not been appreciable success. That is why the global community pivoted to using drugs and using microbicides. However, of recent, this hope is now being rekindled with what we have seen during the COVID-19 and how COVID-19 responded to new technologies in terms of vaccine production. We are hoping that those new technologies are now being deployed. When deployed to HIV, that they will provide the needed breakthrough to have a vaccine that prevents people from acquiring HIV. The trial that started in the United States and now in South Africa will soon come to Nigeria. Nigeria is one of the sites that have been earmarked in West Africa to commence those trials. And when the time is due, we will come to you, the media, to give us access to the public to create the needed awareness for people to know where we are and what vaccine trial means and what to expect, and also what to see at the end of the trial when eventually it is completed.
Thank you so much, Doctor. We are so looking forward to that day when we will announce clinical trials for HIV vaccine in Nigeria. Thank you so much for coming to the show. I know how much effort you put into getting to the studio, and have a nice day.
Thank you, Mary. My pleasure.
Thank you for being there as well and being patient to listen through. Please get to know your status and stay safe. I'm Mary Alale Yusuf. Bye-bye now.